Hello, everyone and friends. Nice to meet everyone on Healthy Seniors Daily. The topic that I want to share today is a problem that is of great interest, especially for those with parents, grandparents who have entered middle age or are elderly. These are signs of early recognition of Alzheimer's disease. Alzheimer's disease not only impairs memory but also seriously affects thoughts, behaviors, and the ability to perform daily tasks. Early recognition is extremely important because it helps us to have timely interventions to slow down the process of progression and improve the quality of life for patients. So, what signs should you pay attention to? Please listen carefully. 1. Forget the new information. One of the first, most noticeable signs in people with Alzheimer's is forgetting new information. The patient may have just heard some information, but only a few minutes later, they forgot. For example, they may not remember the appointment with the doctor, forget the name of the person who was just introduced, or forget what was planned for that day. The important thing to note is that sometimes we can forget, but for the patient with Alzheimer's, the situation of forgetting happens often, continuously, and has a significant impact on everyday life. Note, for patients, persevere in using the tools to support memorization, such as a calendar, noticeable notes in the house. Relatives need to gently remind, avoid blaming, and set up a fixed living habit to reduce confusion. 2. Difficulties in planning or problem solving. When suffering from Alzheimer's early, the patient may find it difficult to plan and monitor familiar activities. Simple things like preparing meals, bills, or following a recipe also become extremely difficult. For example, a person who is careful in financial management suddenly calculates the wrong amount, forgets to pay important bills, or becomes disoriented when doing things that were previously very proficient. Note, relatives can help patients by splitting jobs into simpler steps, helping them to complete them step by step easily. It is also advisable to use notes to support patients in organizing daily tasks. 3. Difficulties in completing the familiar jobs. Another sign is that it is difficult to perform daily tasks, such as cooking, driving to a familiar place, or playing a favorite game. Patients may forget how to operate household devices such as washing machines, air conditioning, or be embarrassed in using mobile phones, although they have previously used them fluently for many years. Note, relatives should create a safe and accessible environment and help patients perform simple tasks. Regularly monitoring and supporting patients in daily activities can help reduce anxiety and danger. 4. Confused about time and space. Alzheimer's often causes patients to lose their direction, location, and even their humanity. They may not realize what day it is, where, or why they are present at a certain location. For example, they can go out to the market but forget why they went out, and cannot find their way home, even in a familiar area. Note, relatives need to be patient and help patients by maintaining a clear and easy-to-understand habit of the day. Placing a large indoor clock, using a note tag on the date and time, can help patients aware of the time more accurately. 5. Difficulties in identifying images and distance. Some patients have difficulty assessing the distance, distinguishing colors, or reading letters. This greatly affects the ability to move, easily fall, or endanger traffic. For example, they may miss the stairs, do not recognize the distance between objects on the way, or do not clearly see the road when driving. Note, relatives should patiently explain and use clear and easy-to-understand images. It is also necessary to ensure the environment around the patient is always neat, with not too many disturbing items, so that they can easily realize and use household items. 6. Language problems in speaking or writing. Communication also becomes more difficult. The patient may be lost in the stream of thinking, unable to find appropriate words, or repeat the same stories in a conversation. For example, they may be telling a familiar story but suddenly stop in the middle because they forgot the next detail, or call the wrong name of the usual object. Note, relatives need to monitor the change in the behavior and mood of the patient, trying to keep calm when faced with negative reactions. Creating a stable and quiet environment can help minimize stress and discomfort for patients. 7. Put the wrong object and lose the ability to find it again. Alzheimer's patients can regularly put objects in the wrong place, such as storing the keys in the refrigerator or putting glasses in the food compartment. When they weren't found, they could even suspect others of stealing. This loss is not only annoying but also creates a sense of insecurity and suspicion in family relationships. Note: relatives need to gently remind and not criticize when the patient cannot remember. Support them by recording important information or creating useful reminder tools for patients to easily access and monitor. 8. Reduce the ability to judge and make decisions. People with Alzheimer's often make unreasonable decisions. They can spend uncontrolled, easily be cheated by phone, or wear outfits that are not suitable for the weather, such as wearing a thick jacket in the hot summer. The ability to identify dangerous situations, such as when crossing the road or cooking with gas stoves, is also seriously reduced. Note: relatives can create a habit of sleeping regularly, helping patients go to bed and wake up at the same time every day. Making sure their bedroom is dark and quiet will help improve sleep quality. 9. Withdraw from social activities. People with Alzheimer's often avoid social communication due to feeling embarrassed about communication difficulties or because they no longer recognize those around them. They can ignore previous favorite activities such as playing sports, joining the group, going to the temple, going to the church, and gradually retreat to their own world. Note: relatives should patiently listen and support the conversation, avoid cutting or urging the patient to quickly answer. Use simple, easy-to-understand questions to help patients easily continue the conversation. 10. Change mood and personality. Finally, the change in mood and personality is also a recognizable sign. Patients may become anxious, easily get angry, disappointed, bewildered, and even experience outbreaks of anger for unknown reasons. They may suspect relatives, feel threatened in strange environments, or fear even at home. Note: relatives should encourage and create conditions for patients to participate in simple activities, whether it is just walking in the park or sitting together to watch a favorite movie. Also, you need patience, don't press if the patient does not feel comfortable. Ladies and gentlemen, Alzheimer's is a complex disease and progresses silently. The recognition of early signs plays an extremely important role, giving patients the opportunity to be diagnosed, treated, and supported psychologically promptly. If you notice yourself or relatives who have the same expressions as if you have just shared, do not hesitate to go to the medical facilities specialized in neuropathy. The attention, love, and companionship of the family are the biggest encouragement for patients in the journey to fight Alzheimer's. If this video is useful, click like, share with friends and relatives to know, and subscribe to the channel to continue accompanying you on health and life care journeys. See you again in the next videos.